Today is our 2030th day of continuous webinar. Thank you everyone for supporting us and being with us. And today's our speaker is Dr. NIPUN Singh Dabi. He is MD in Homeopathy and PhD scholar. He is Assistant Professor in Rajkot Homeopathic Medical College, Parul University, and Director of Dabi Homeopathy Consultancy Private Limited. Today's our subject is managing lifestyle disorder through homeopathy. Dr. Nipun Singh, you are welcome to IFPH webinar. Please.
Ma'am, I am audible?
Yes, doctor. Audible and your screen share is visible.
Okay, ma'am. Good evening, everyone, respected faculties and respected practitioner. Myself, Dr. Nipun Singh Dabi, and today's topic on our session is managing lifestyle disorder through homeopathy. Now, before we begin this session, I would like...
Doctor, can you open your camera? If it is open, that will be more nice. Yeah.
Yes, ma'am. Is it visible?
Yes, yes.
Okay, thank you, ma'am. Before we proceed to our session, I would like to show you some learning outcomes, what we are gaining from this session. The first is we would be knowing about lifestyle disorders which are prevalent in today's world, and the global burden of disease and the risk factors which are promoting these factors. Also, how this lifestyle disorder are tackled through lifestyle medicines and its preventive role. The homeopathic reasoning and paradoxical presentation in lifestyle disorders. Certain constitutional remedies and organ-specific remedies in homeopathy which are helpful in managing these lifestyle disorders, and the role of integrative lifestyle medication, which is now prevalent in today's time, and our Ayush system is also promoting it. So let's begin to our session. Before we proceed, this is the image I would like you to see to it and understand that it is the normal lifestyle of present world, and everyone is going through this in the corporate world, in the professional world, in the student lifestyle. Now, what do you gather from this image? You see a person who is following a sedentary lifestyle, who is working or going to his profession in a polluted environment and relaxing without undergoing any exercise and eating this fast food and Western diet. And these are the problems which arise from this lifestyle, such as obesity, diabetes, heart disease, fatty liver, and stress. And this is the basic theme of our today's session. And the first, we start from the lifestyle disorder. What are lifestyle disorder? We hear about them all the times in newspaper, in our classrooms, in our clinics also. Patient also tells about that, sir, he is suffering from lifestyle disorder. What to do in that? So basically, lifestyle disorder are just non-communicable diseases that arises primarily from the unhealthy lifestyle choices such as poor diet, physical inactivity, alcohol use, smoking, and chronic stress. This lifestyle disorder include cardiovascular disease, type 2 diabetes, obesity, hypertension, cancer, and chronic respiratory diseases. Lifestyle disorders are illnesses linked to the way people live their daily lives. So I have shown to that images. These are basically non-communicable and develop gradually due to a long-term exposure to unhealthy habits. We can differentiate that from the CMN disease, that is communicable maternal, neonatal and nutritional diseases such as infectious agents. They are strongly associated with the behavior and environmental risk factors and are preventable through lifestyle modification. The basic mechanism or hypothesis that is given in the development of lifestyle disorder is insulin resistance and metabolic syndrome. The insulin resistance and the obesity, which is characterized by dyslipidemia, that is imbalance or abnormal lipid profile in your body, which give rise to the metabolic syndrome that is composed of type 2 diabetes, pre-diabetes, hypertension, dyslipidemia itself, non-alcoholic fatty liver disease, and PCOS in women. These are the metabolic syndromes, and they are arises from the insulin resistance, which affects the hormones and the leptin hormone secreted by the central obesity fat cells. So basically, this is the lifestyle disorder and the 5 prevalent lifestyle disorders in today's world. Clinical importance, how does they affect? Basically, they are linked to the obesity, I have already told you. The major driver of them are cardiovascular disease, diabetes, and liver diseases manifesting through atherosclerosis or fatty liver, which going toward the NAFLD and cirrhosis. This metabolic risk in the form of obesity and hypertension or dyslipidemia highlights the global burden of disease 2023. Thus, GBD is just a cross-sectional study that undergoes every 3 to 4 years, which measures the overall health of the population of the world. So in this factor from 2017, last was done in 2019 before COVID, and sorry, the second last was done before COVID, and the last one is done in the 2023. How do we manage this disorder? Basically, the lifestyle disorder arises to the imbalance in lifestyle. So the strategies applied are the diet, exercise, stress reduction, and individualized medical care, which we are going in later stages. And the homeopathic part can be ascertained through holistic approach, conventional management, through which we address the metabolic imbalance and behavioral triggers. The GBD has given 8 categories of the lifestyle disorders, which are metabolic disorders, cardiovascular disorders, endocrine disorder, respiratory disorders, cancers, mental health disorders, musculoskeletal disorders, and others. In the metabolic disorders, obesity, type 2 diabetes, metabolic syndrome, and dyslipidemia, they are the prevalent. Their risk factors are high calorie diet, sedentary lifestyle, and stress. The second category is of cardiovascular disorder, in which hypertension, coronary artery disease, stroke, and atherosclerosis, they are the more prominent, which are further introduced through dyslipidemia, smoking, stress, and poor diet. The third category is of endocrine disorder, which is basically the imbalance in hormone system, more notably in the thyroid dysfunction and in the PCOS. They were also affected by the stress, obesity, and hormonal imbalance. In the respiratory disorder, we have COPD and asthma, and it is affected by the air pollution, which is now notably the 4th topmost risk factor in the GBD. The other 4 are cancers. Cancers arising are in the lungs due to air pollution, colorectal cancer due to dietary factors, liver cancer are due to dietary factors, and breast and prostate cancer are mostly due to hormonal imbalance. Their risk factors are tobacco, alcohol, processed food, and environmental toxins. In the mental health categories, we have depression, anxiety, stress-related disorder, which are also produced by chronic stress and poor sleep. In the form of musculoskeletal disorder, which generally affect the geriatric age group, these are osteoarthritis and osteoporosis due to sedentary lifestyle, decreased bone mass density, and poor nutrition. And the others in which the CKD is involved, chronic liver disease, cirrhosis. CKD is also involved due to type 2 diabetes complication and irritable bowel syndrome, which is just a functional disorder that is also due to an imbalance or use of processed food. Moving to the next slide. This is the global burden of disease, which is the studies done in 2023. It states that obesity and overweight, according to WHO, are 66% of US adults are suffering from this disease. This disease is going to increase by 2030. The more important factor is higher morbidity and mortality from the cardiometabolic disease. What are the shifts we observe after the COVID? That is, the infectious diseases are generally decreasing in spite of certain epidemic in form of COVID, Nipah virus. The mounting challenges is of diabetes, mental disorder, obesity, and overweight. Moving to the next slide, in India, in our country, the India is going to be the second most obese country in the world. The rising prevalence among children and adolescents. This is the projected population growth. You can look at the age group 5 to 9 and 10 to 9. These are the pediatric age group, which are the backbone of our country and young population. They are going to be affected by the lifestyle disorder. And the projection of the 2040 is that 20 million children living with obesity and 56 million children will be overweight and obese. The leading cause of early death and disability due to lifestyle disorders are diabetes, anxiety disorders, and depressive disorders. And the risk factors which are increasing and causing disease associated life year loss are the high blood sugar and high BMI. The non-communicable disease contributed to 1.45 billion DLY in 2010, which have increased to 1.80 billion in 2023. These are the certain data we have gathered from the Lancet study from GBD 2023. This is the overall picture. You can see the CMNN disease, which was known as communicable, maternal, neonatal, and nutritional disease. They are on the decline. There were 74 million cases in 2010, which have now come to 681 million in 2023. They are mostly regulated through vaccination, improvement in hygiene, and vaccination and antibiotic medication, due to which we have been able to lower these diseases. But the more burden is rising in the form of non-communicable disease. That was 1.82 billion have been rise to the 2.19 billion into 2023. The most important risk factors I have already discussed is the smoking, diet, and inactivity, and the urbanization. This is just a snapshot of the non-communicable disease which are prevalent, such as ischemic heart disease, stroke, diabetes, and there is large increase in anxiety disorder and depressive disorder. The ischemic heart disease is the topmost category in the non-communicable disease, presenting in the form of MI, unstable angina, and aneurysm. These are the risk factor driving NCD-DUS. The global burden of disease study gives us the top 5 risk factors, in which number 1 is high systolic blood pressure, high fasting plasma glucose, high body mass index, smoking, and the new one, ambient particulate matter pollution, that is the air pollution in the form of 2.5 pm and 10 particulate matter, that is increasing, which is causing increase in metabolic risk, increasing despite decrease in 6.7% in age standardized race. There is the CMN disease are also decreasing due to unsafe this disease are increasing due to unsafe sanitation, unsafe water, and child growth failure. These are the risks which have been in decline. What causes this metabolic risk and lifestyle disorder in the low income countries, such as in Bangladesh or South Asian countries, including India? There is unfinished CMN agenda with rising NCDC. There is decrease in the sustainable development goals. Our target for the sustainable development goals in 2020, which was not reached. So that was increased to the 2030. There is also a double burden of disease and the policy priorities by the government, which are in the form of food security, healthier diet, promotion of physical activity, tobacco and alcohol control, and equitable access to treatment to all the patient. This is just this slide is telling that the CMNDs are on a decline and NCDs are rising globally with the risk factors involving BMI, blood sugar, smoking, and pollution. I have already discussed these 3 risk factors. Before proceed to the next level, the GBT study gives us certain factors in the form of metabolic risk, behavioral risk, and which goes on to develop the lifestyle disorder. They are here shown by this picture. You can see on the level 1, they are top risk categories of the behavioral risk, metabolic risk, and environmental and occupational risk. Behavioral risk is generally due to drug use, alcohol use, metabolic risk due to lifestyle choices, dietary factors, and environmental risk is generally due to air pollution and some social or social factor present in the environment. This gives rise to the level 2 risk factors such as high blood pressure, air pollution, smoking, high BMI, high blood sugar, which gives rise to the high systolic BP. These are the risk factors: high systolic BP, PM 2.5 pollution, tobacco use, obesity, and high fasting plasma glucose. All these risks give rise to this disease outcomes in the form of heart disease, stroke, diabetes, cancer, and chronic lung disease, which are the categories of the lifestyle disorder given by the GBT studies. This is also the same slide, generally explaining the cancers such as lung cancer, which are on the rise, colorectal cancer, breast cancer, liver cancer, and bladder cancer. Also, there is a age-specific risk strength among the children, youth, adults, elderly, and among the sex. In children between the age of 0 to 14 years, mostly are affected by air pollution, malnutrition, and household smoke. The youth is affected by the 15 to 29 years through behavioral risk in the form of smoking, alcohol, diet, and injuries. The adult age groups between 30 to 59 years, of all this accumulation of all these effects give rise to high BMI, blood pressure, and glucose. And elderly, which is now the age is 60 plus year, but the cases are coming in the 40 age groups in the form of MI, heart attack, cholesterol increase, and diabetes related risk. In the man and woman, generally men are more affected by smoking, alcohol, blood pressure, and cholesterol. The women are more suffering from the obesity, physical inactivity, and diet related risks, which are causing hormonal imbalance and resulting in PCOS and NAFLD. This is the new risk factor, air pollution, which has rise in the ranking of the global burden of disease, and top risk factor, the air pollution. The air pollution is generally affecting the people and reducing the life years. From in urban region, it had reduced the lifespan from 10 years. In rural areas, there is decrease in 3 to 4 years of age. What factors are contributing to the air pollution? There are 4 categories. One is the ambient 2.5 air pollution. There is ambient ozone, nitrogen dioxide, and household air pollution. Mostly, the more important factor is the fine particulate matter that is released from the vehicles, industrial activity, and crop burning. The second release from the ground level ozone from the chemical reaction to urban smoke, traffic, and sunlight. The third is nitrogen dioxide that released from the burning of toxic gas from combustion, that is vehicles and power plants. And the household air pollution, which is now has been reduced due to use of stove and induction. But generally in rural areas, this factor is on more prevalent and most important for the COPD, such as wood burning, dung, coal use, and cooking and heating. How does the air pollution act as a risk factor? First, it causes inflammation and oxidative stress that triggers systemic inflammation, damages blood vessels and lung tissue. Second is vascular dysfunction. It causes impairment in endothelial function and increased blood pressure, which causes increased stroke risk. Third one is immune suppression. Chronic exposure weakens immune defenses and increases infection risk mostly in the form of pneumonia, but also in the form of allergic reactions such as hay fever, which are generally not infectious but are allergic disorders, are prevalent in urban region. And the fourth impact is on the fetal and neonatal. The exposure causes during pregnancy leads to low birth weight, preterm birth, and neonatal disorders. So all these factors, high BMI, air pollution, stress, hypertension, and increased BMI. They all are risk factor producing the diseases which are given in the 8 categories. So basically, what do we have to control? Do we have to control the disease, or do we have to control the risk factors which are prevalent since birth and affecting the youngs as well as the infants and causing this disease which are now presenting in the young age, in the age of 40 years, 50 years? The policy priorities of the government should be on the lifestyle disorders. First, through controlling metabolic risk, such as reducing the high SPP, systolic blood pressure, BMI, and fasting plasma glucose. Behavioral risk through smoking and drug use. Environmental risk have to be reduced, such as air pollution, for the betterment of public life. And public health policy should be focusing on the food security and healthier diets, promotion of physical activity, and equitable access to the treatment. Now we move on to the disease association. So we have generally talked about the risk factors. These were the risk factors and how do they introduce these diseases in our body. For example, high systolic blood pressure gives rise to the stroke. Stroke is an acute focal neurological deficit that presents in the form of hemiplegia, slurred speech, vision loss, or maybe a prolonged paralysis in the form of hemiplegia, quadriplegia, or paraplegia. Other is ischemic heart diseases in the form of MI and unstable angina. And other one is the chronic kidney disease by damaging the afferent and efferent arterioles of the kidneys. The high fasting plasma glucose also give rise to the type 2 diabetes mellitus. We all know that. CKD and the complication of diabetes such as neuropathy in the form of peripheral neuropathy or autonomic neuropathy, also in the form of dermopathy and diabetic ulcers. The high BMI, which is in the form of also the total cholesterol and dyslipidemia, give rise to the type 2 diabetes mellitus, hypertension, sleep apnea, atherosclerosis, and also the stroke. The CKD markers in the form of chronic kidney disease, such as low GFR and albuminuria, comes under the chronic kidney disease, cardiovascular complication, and end-stage renal disease, where the dialysis is the last choice without which the patient cannot survive. So these are the risk factor, metabolic risk factors give rise to the primary diseases. These are the behavioral risk factors which are contributes in the development of metabolic risk, which now produces the increased risk burden. First is the unhealthy diet that raises the blood pressure in the form of Western diet we are using, increase sodium in our diet, increase fat intake in the form of saturated fats, which give rise to the waist hip ratio and BMI, and increase fasting glucose. They are rising towards the diabetes and cardiovascular disease. Smoking, which worsens the blood pressure through nitric oxide, damages vascular function, raises insulin resistance, giving rise to the COPD and heart disease. The alcohol use give rise to the generally liver diseases in the form of NAFLD, cirrhosis, and certain liver cancer such as hepatocellular carcinoma. The physical activity, which is generally our day-to-day activity, it produces high BMI because we are not exercising. So our fat is now getting deposited in the muscles and in the central sphere of our trunk, which give rise to the musculoskeletal disorder due to sedentary lifestyle, decreased bone mass density, and through diabetes and heart diseases. The air pollution also exacerbate hypertension, insulin resistance, and give rise to the respiratory disorders. So basically, these all are the risk factors and the main disease outcome from this disease. They are on the rising rapidly, affecting both lifestyle changes and aging population. We have to manage this disorder to prevent and to unburden our elderly and young ones from these main diseases. Now, this were all the lifestyle risk disorders caused by metabolic factors, behavioral dis. With the advent of lifestyle disorders arrives lifestyle medicine. Now we are hearing this about lifestyle medicine all over the news, and is generally a new faculty developed by the American Health Association, lifestyle medicine. Now, what does it do? The lifestyle medicine is generally a medical specialty that applies therapeutic lifestyle intervention to prevent, treat, and often reverse chronic and non-communicable disease. In this category, in this medicine, we do not use therapeutic prescription such as medicines. We do not use. We generally use the good habits in the form of exercise, in the form of well-balanced diet, in the form of fibrous diet, in the form of low sodium diets, in the form of high protein intake, in the form of Mediterranean diet. So this all do we use in the lifestyle medicine. It is an evidence-based changes in nutrition, physical activity, sleep, stress management, avoidance of risky substances, and fostering social connection, which is now more prevalent in and now and more necessary in today's world, in the AI world, in the social world, where the people are more connected on the internet and not physically. The third one is the goal is to address the root behavioral and environmental cause of the disease rather than only managing the symptoms through medications. The lifestyle medicine generally effective in the cases of cardiovascular disease, type 2 diabetes, obesity, hypertension, and metabolic syndrome. It emphasizes sustainable life changes for long-term health. Patients are empowered to take active role in managing their well-being without relying on the pharmacological treatment. That is the main goal of the lifestyle medicine. These are the factors which we need to cover under this lifestyle medicine, such as nutrition, physical activity, restorative sleep, which is disturbed by use of smartphones and blue light, stress management in the form of mental and physical stress through work hours, disturbed work hours, and unequivalent and improper sleep lifestyle or sleep cycle in the form of disturbed circadian rhythm and homeostasis. The other one is positive social connection. We have to form the connection, go into the therapies, as we say in the psychology. How do we treat some and we mental patient? How do we counsel them? So we advise them to go toward in the family therapy, group therapy. The other one is the avoidance of risky substances such as smoking, alcohol, and drug abuse. This includes the whole person health, focuses on the high value clinical care delivery and comprehensive care delivery. Role of certified clinician, as I already said, the lifestyle medicine is a new faculty. So the new certificates are also given to the clinician who studies the lifestyle medicine. This is generally behavior changes we have to do. Now, in the lifestyle medicine, what are the changes we face? What are the challenges we are facing in lifestyle medicine? Generally, if we say that we can treat the lifestyle disorders with lifestyle medicine by developing the good habits, then it is not going to be possible. The patient is not going to listen to you, not going to develop the habits only for the sake of treating the disease. He is going to rely on the pharmacological treatment, and which are the more causing and more burdensome on the society, on the health policies, and on the patient health. Generally, the challenges we face are the lifestyle-related chronic diseases, disproportionately affecting the minority and lower income communities, where they are more worried about their jobs, finances, and worried about their health. The COVID-19 exposed this vulnerability in the form of morbidity. The patients, such as suffering from the diabetes, hypertension, they were more morbidity and more vulnerable to death. The prognosis were poor in those cases. The misconception about lifestyle medicine is that it often perceived only for the wealthy people and not for the poor. Also, everyone deserves the lifestyle medicine. The basic gap is that of the lifestyle medicine is that the 87% of cardiologists reported no formal training in the lifestyle medicine. Despite this, 41% frequently recommended whole food plant-based diet for cardiovascular prevention, but only 8% of those doctors follow this diet. So you see there is gap between the physician-patient education. First, about the physician and how does he impart education to his patient. There is also concern about protein adequacy, social and cultural changes, and patient compliance difficulties. Now, these were the disorders we have discussed about and the risk factor. Now, in the modern medicine and conventional treatment, the modern medicine has come with certain medication in the form of Ozempic, retatrutide, or certain surgeries in the very gastric surgeries to reduce the BMI, fat, obesity. Basically, what we are seeing that we are generally suffering from more risk side effects. Common side effects are nausea, digestive issue, potential for low blood sugar and headaches. Some newly developed drugs such as Ozempic are causing unknown long-term side effects. Certain drugs in the form of fake or unlicensed products are in the market. Many medicines are sold illegally. Generally, the regulatory environment is not tight, such as American Health Association in the UK, and GPHC rules are not so much strict about this disorder. The patient is, what are the realistic expectations and tips for the success? The patient is also choosing this effect because they are easy to obtain in the form of Ozempic medicine, gastric surgery. So, what are these realistic expectations should we expect by the patient? That the medications support weight loss, but they are not magic. Second factor, the best result come when medication is combined with healthier eating, regular physical activity, and behavioral changes. The third is the weight loss timeline. Many people start seeing results within a few weeks, but full effects may take several months. So one has to be patient and consistent. Fourth one is to monitor and adjust our work routine, and we have to work with our clinician to adjust dose and track side effects. The fifth one is about the stopping the medication when the plan is not needed or we have to maintain the loss. These are some modern medicine drugs which are prescribed for the weight loss, such as Ozempic, Ribelsus, tirzepatide, liraglutide, oral start. How do they reduce the BMI or fats? In the form of GLP-1 receptor agonist by reducing the appetite, slows digestion, and enhance fullness for the long time, due to which the patient does not eat and he thinks that he is losing weight or he is not getting hungry. Who might be eligible? These are the categories which are prescribed by them. So those who are in the category of overweight or less than 30, which are not coming in the category of obese. Patient with high BMI or thresholds, comorbidities, and certain patient who are using some certain other drugs, they are also not eligible. This medicine, which used to be best combined with diet and exercise and suited for mild moderate obesity. Now we have seen the modern medicine concept. What is the homeopathic perspective in this lifestyle disorder? The first one I have written is the therapeutic and clinical application, not the individualized remedies. The second is individualized remedies you can prescribe to the patient after looking at the case. Third one is the holistic approach, which involves lifestyle medication. Other one is the complementary loads, along with we have to work with Ayush medication, Ayurveda, or certain diets, exercise. And the fourth one is integrative medicine about the patient-centered care, looking at the long-term compliance, long-term health, and sustainable outcomes. There is a comparative analysis of their medicine in the form of lifestyle medicine, conventional medicine, and homeopathy. Basically, lifestyle medicine focuses on the root cause, that is prevention through lifestyle. The conventional medicine focuses on the drugs which I have already said, such as Ozempic and surgery, gastric surgery. The homeopathy, which we are going to discuss, mostly look at the individual patient and the therapeutic utility of the organ-specific drugs. The approach is the behavioral and environmental modification. In the conventional medicine is about pharmacological procedure, and in the homeopathy, that is holistic and constitutional. The conditional target are most lifestyle disorders such as NCDs, diabetes, CVDs. In conventional medicine, they have answer for all the diseases in the form of drugs. In homeopathy, we generally prescribe antimiasmatic drugs or certain lifestyle changes towards the patient because the lifestyle disorder are generally caused to maintaining cause in the form of BMI, hypertension, or high metabolic risk. The patient role is generally in the lifestyle medicine is active. In the case of conventional medicine, the patient is the passive recipient of treatment, and in the homeopathy, the patient has to be active along with the lifestyle changes. This is the age group which are mostly affected through these factors. The high systolic blood pressure is more prevalent in 50 plus years. The high fasting plasma glucose, which is the impaired diabetes now coming in the early age, that is 40 plus years or in the 30 also. The high BMI and high total cholesterols are the young patient who are generally dependent on the Western diet, are eating fast foods, generally have high BMI, waist hip ratio, and disturbed lipid profile. The risk factors are generally the same as are the metabolic risk factors. They are only causing the increase in the NCDs diseases, diabetes, cardiovascular diseases, and certain cancers. And this is just a snapshot of the risk factors which are affecting the patient. We don't have to go through this. Now, in all this part, where does the homeopathy come? Because we are suffering from the lifestyle disorder, we are looking at the metabolic risk, we are looking at the behavioral risk. So, where does the homeopathy come? The first concept in our homeopathy is the anamnesis. You all have heard about the anamnesis homeopathy. It is basically the recollection and refers to the comprehensive collection of the patient health history because the metabolic risk and behavioral risk are generally present from the young age and the disease we are facing are coming in the later stage. So the whole history of the patient is generally more important in the form of family history or certain disorders. What is its importance? It is fundamental to homeopathy and homeopathic case taking. The holistic understanding goes beyond symptoms to explore physical, emotional, lifestyle, and environmental influences. As we have seen, the factors which are affecting the diseases are environmental as well as lifestyles, not only biological and social. Also, the identification of miasm. For example, in the case such as in the case of MI, there is a syphilitic history. In the case of a stroke, there is a syphilitic history. In the case of obesity, there is a psychotic history. In the case of psoriatic disease, which are more prevalent in mental disorder or air pollution. So there is a psoriatic history that is on the predominance. So we have to look for the miasm also if we are going to treat the patient holistically. The anamnesis looks at the patient-practitioner relationship. One has to build trust and encourages the patient to share their complete health narrative. There is also the personalized treatment, which is the outcome of our case taking, which enables the selection of remedies that matches patient unique constitution and health context. Also, this process help in the initial consultation and open-ended question. The process requires careful observation of verbal and non-verbal cues and detailed documentation of guided. Basically, anamnesis is generally we are looking at the case taking through homeopathic perspective. Along with the lifestyle disorder, there is also a rise in the psychosomatic illness, which are mostly involved are caused by the risk factors, basically social and psychological. The psychosomatic illness, what are they? They are the psychosomatic disorder, physical illness that is either caused or worsened by psychological stress or emotional conflict. The term was coined by Henroth in 1880. In the ICD-11 classification, the code is 6E40. That is, it comes under psychological or behavioral factors associated with the disorder or disease classified elsewhere. What comes under this are the psychological trigger, that is chronic stress, which elevates your cortisol and increases hypertension. Anxiety, that increases your heart rate, causes tachycardia, and certain digestive imbalance in the form of diarrhea. Suppressed emotion, which are affecting your immune system, and certain skin disorders. And depression, which are giving rise to the fatigue, sleep disturbance, pain sensitivity. The chronic stress, which is generally regulated by the cortisol, your hormone, mostly secreted by the adrenal gland, responsible for your maintenance of circadian rhythm, elevation, your alertness. These are the three things which are controlled by the cortisol. In today's world, where we are facing mental stress on the jobs, on the family part, in the form of emotional and social isolation, the cortisol is on the rise, giving rise to the hypertension and stroke. This is a biopsychosocial model given by the Hanroth. There are psychological factors such as emotion and cognition, shared factor in the form of social support such as stressful life events, social norms, and biological factors which the patient is born with, such as genetic factors, hormonal factors, certain immune system or immune diseases, or disturbance in neurotransmitters such as acetylcholine, adrenaline, epinephrine, or GABA, which give rise to your sleep disorders such as insomnia, insomnolence. Now, the psychosomatic illness are generally affect type A personality. What are the characteristics of type A personality are basically the psoriatic disorder, that is competitive, time pressure, prone to hypertension and heart diseases. There is an emotional suppression linked to autoimmune and skin disorders. There is poor coping mechanism with substance abuse, avoidance and denial, and chronic stress exposure in the form of workplace, family, and financial pressure. These all factors are affecting and causing psychosomatic illness. Generally, there are many psychosomatic illnesses, but these seven are the more prominent. One is bronchial asthma, essential hypertension, thyrotoxicosis, neurodermatitis, peptic ulcer, ulcerative colitis, and rheumatoid arthritis. This basically the one rheumatoid arthritis, neurodermatitis, ulcerative colitis are generally immunomodulatory disease, autoimmune diseases. Bronchial asthma is increased through stress and also through the air pollution. The essential hypertension generally caused by your fasting plasma glucose and increased BMI, obesity. These are the factors that are involved in this essential role of essential hypertension. The next we move on to the homeopathic medicines. We have seen lifestyle disorder. We have seen the metabolic risk factors and behavioral disorders. But what are the medicines which a homeopath can prescribe to the patient? These are the lifestyle disorders such as type 2 diabetes or pre-diabetic stage. The basic medicines are in the form of Zyzium jambolanum, Gymnema sylvestre, phosphoric acid, and uranium nitricum. They basically regulate glycemic regulation, as well as if the disease or diabetes originated due to gastric trouble, then we need to prescribe uranium nitricum. So obesity and high BMI, how do we control or how do we decrease our dyslipidemia, cholesterol level, triglyceride level? These all are your constitutional medicine, calcarea carb, antimony crude, lycopodium brevitum. But these two drugs are the organ-specific drugs such as Terminalia arjuna and Gotiria gumeri, which are basically prescribed by the physician and are generally increasing in use in today's world or in our clinic profile. The third is of the hypertension and systolic blood pressure. These all are the constitutional medicines such as paracetamol, clonine, which generally prescribed naxomica and belladonna for the BP regulation in the acute cases or in the chronic cases. In the metabolic cluster, we all have sulfur, naxomica, natramures, and CPR that generally affects the constitutional and hormonal influence or hormonal profile of the patient. So, the remedies, these are the common remedies along with we have certain organ-specific remedies which we need to prescribe to the patient for the betterment or to reduce the risk factor. Because the constitutional medicine generally we prescribe in the high potency and we do not frequently repeat them. But for the repetition, we look for the organ-specific or certain acute remedies. These are the categories of disorders, or according to categories, we have division of the medicine and their application towards and how do they reduce, such as in the metabolic disorders. This medicine generally affect lipid metabolism and metabolic imbalance. In the cardiovascular health, the medicine regulate your BP, your vascular tone, and your atherosclerotic tendencies. In the endocrine disorder, our medicines affect the hormonal imbalance and obesity-related endocrine dysfunction such as PCOS, NFLD. The respiratory disorder which are common and generally these are the common remedies: arsenic album, antimony tart, Plata orientalis, ipecac, or spongia tosta. They are generally used in the urban profile or urban region. This is again the categories of the cancer. Here we are come with carcinosinum, thuja, conium mac, and phytoleca, as well as citric. They are deep-acting remedies and constitutional remedies in which we need to prescribe an antimiasmic drugs intermittently. We need to prescribe them. In the mental health disorders, we have ignatia, auromet, califos, phosphorus that generally regulate your stress, poor sleep, and emotional imbalance. In the form of musculoskeletal disorder, in the musculoskeletal category, such as osteoarthritis and osteoporosis, we have calcarea fos, symphytum, arnica montana, castox for the joint degeneration, bone weakness, and pain management. In the category of Pseudomonas or others, in the chronic liver disease, kidney, we have Chelidonium, Barbaris vulgaris, Lycopodium, or Calcarea sulf. These are the drugs adrenally which we prescribe for the CKD patients. Also, other miasmatic affection that underlines the disease, such as SORA, mostly affect the nervous system and nerve centers and produces functional disturbance in the form of mental disorders, which give rise to the skin eruption and external symptoms. The syphilitic stigma, if the metabolic risk factors are more prominent, that then it may affect brains in the form give rise to the stroke, hemorrhages, aneurysm, to the larynx and throat, the throat cancers, in the bones and peristonium, skeletal disorders, osteoporosis, and deep-acting pathology. The psychosis miasm underlines our infiltrative or hypertrophic disorders such as obesity, dyslipidemia, cystic formation or cystic degeneration in the PCOS, in the liver, or in the kidneys. Development of cyst, it generally comes under the psychosis. It mostly affects your pelvic and sexual organs. This is the basic mechanism through which we identify our miasm. SORA, affected by the functional part, the syphilitic stigma through ulcerative manifestation, and psychosis through infiltration and deposits in the form of cyst, hypertrophies. These are the adjuvant medicine or organ-specific medicines which we gives or which we are normally see a rise on the and in the clinical picture, more and more physicians are prescribing these medicines. For in the case of obesity, we are seeing the use of phytoleuca berry, Poteria gomeri, Terminal arjuna. In the case of diabetes, Abroma augusta, Caesium jambulinum, Gymnema sylvestre, Cephalendra indica, and Pandiatinum, which are given by the CCRH and Ayush Center. In the case of dyslipidemia, we have Terminal arjuna, Ilium sativus, Fucus fasciculosis, and Poteria gomeri. Other drugs, Adonis vanalis, which is generally deep-acting and mostly prescribed in the cases of heart factors. Cholestyrinum, also a organ-specific remedy during in the cases of gallbladder disturbance or liver disorder. This is the diagnostic criteria for metabolic disorders. First, which we have here, is the diabetes. I believe we all people know about what is the diagnostic criteria for diabetes. That is fasting plasma glucose, postprandial, random, and HbA1c. The most important is the HbA1c, which gives the 3 months average rate. The patient have a level above the 5.7, it comes under the pre-diabetic stage, and if it is above 6.5, that is the diagnostic of the diabetes. Generally, we have to maintain the level between 5 to 7, 5 to 6 in the case of diabetes patient. The management of diabetes through lifestyle modification is through balanced diet, regular physical activity, weight control, and avoidance of tobacco and alcohol. The HbA1c measurement has to go through every 3 to 6 months. And the pharmacotherapy for the conventional medicine is metformin, which targets the HbA1c below 7%. This is the diagnostic criteria for hypertension, which is generally above the 140 and 90 mm of Hg for the patient. I am not going into the detailed part of this. For the diagnostic criteria of mental disorder, we have to look for the symptoms. In the case of depressive disorders, we have low mood, fatigue, sleep disturbances. In the case of anxiety, we have worry, fear, tachycardia, difficulty controlling worry, significant distress, impairment, muscle tension, sleep disturbance, which lasting more than 6 months. In case of stress-related disorders, they may be in the form of PTSD, intrusive memory, nightmares, or night terrors. We can look for them. This is for dyslipidemia category. That is the total cholesterol, LDL cholesterol, HDL cholesterol. We measure all these 4 quantities to observe the patient is generally suffering from dyslipidemia or not. Also, in the case of dyslipidemia, one has to look for the obesity. The older times it was measured by the BMI. In the newer diagnostic criteria, the waist circumference is also introduced for the diagnosis of obesity and metabolic risk produced by the obesity. Basically, we have to measure the waist and hip ratio in the hip circumference. In the cases of men, if it is less than 94 centimeter, or in case of women is less than 80 centimeter, the risks are negligible. But as soon as the ratio rises from the 94, and in case of women from 80 to 88, the risk increases. This is basically the management of the dyslipidemia. Now, we have gone through the lifestyle disorder. We have gone through the metabolic disorders. We have gone through the behavioral risk. But what is the dilemma of homeopathic physician dilemma? If the patient comes to our clinic, what do we face? For example, if a patient comes to our clinic for the obesity, so he can choose the Ozempic drugs, conventional medicine, or he can choose the surgery. But what do we offer to the patient? If the patient comes for hypertension, if the patient comes from diabetes or increased fasting plasma glucose, how do we manage these cases in our OPDs, in our IPDs? So the first question is, if a patient comes with everything normal, no sign or symptoms, but routine investigation shows increased lipid profile. So the patient's symptoms and signs are normal, but the lipid profile or the investigation are abnormal. So what does it indicate? The second is, let's say the patient comes with hypertension, which is generally an accidental diagnosis or incidental diagnosis, with lifestyle normal, yet he has the disease. So what we are saying is the patient is suffering from hypertension in spite of the normal lifestyle, or the lifestyle which patient is saying that it is normal for his. The third one is if the patient comes with obesity and increasing weight, yet his investigative profile results are normal. You can look at the patient, his BMI and waist circumference are normal, but if you go for the lipid profile, they all comes in the normal range. The fourth one is if there are no risk factor present, and in some condition risk factors are there, but no abnormal lab investigation. So what should we do? The other dilemma is if the patient is lean thin with normal body weight but abnormal lipid profile. What should we do in these cases? How do we choose between the constitutional and adjuvant organ specific medicine? And what do we tell our patient when everything is normal in symptom profile or in the cases of laboratory investigation? How do we handle our patient if we choose for the Ozempic or statins? So how do we address our patient? So the basic approach is same. We have to do anamnesis, have to do case taking, and find out the risk factors. There is homeopathic reasoning in these cases. First, how do we choose constitutional medicine? For example, it is chosen when the patient totality of symptoms in the form of mental, emotional, physical traits point to deep miasmatic root. Example, calcareous Ka for obesity with sluggish metabolism, sulfur for latent sora and functional imbalance, and lycopodium for lean patient with liver dysfunction. These are the organ-specific remedies which we have to choose and which we have to prescribe to the patient for months to reduce the biochemical profile in the form of lipid profile, because the single simple dose of constitutional medicine are not going to change or produce any alteration in the lipid layer.
Doctor?
Yes, sir.
Doctor, we have only 2 minutes. So I think you have more slides to present, right? So we will begin another session in the next days.
Okay,
that because we cannot hurry up.
Yes,
that's a very good idea. It's a big subject, and this is a big subject, big topic, and we need some more explanation to all these things, and we can have the second part.
That will be more nice.
Yes, I have certain cases of organ-specific remedies which we can show in the next lecture anytime.
And we have question in the chat box from Dr. Vibhu Prasad Pandla, which is more important in the management of lifestyle disorder, correction of lifestyle management, or an integrated approach. Have you seen the question?
One minute, ma'am.
I will read it.
Yes, ma'am, you can read
it. Which is more important in the management of lifestyle disorder? Correction of lifestyle, medicinal management, or integrated approach?
Ma'am, the best is the integrated approach. But what my session has told here at the introduce here is that we have choices in the form of conventional medicine, lifestyle medication, and an integrative approach. The lifestyle medication is generally you have to use good habits. For example, a morning walk, aerobic exercise, 30 minutes, minimum 30 minutes per day, 5 weeks a day, aerobic exercise we have to apply. But here I have shown you some certain drugs such as Terminal Arjuna and Goteria Gomeri, which are more important in cases of fasting plasma glucose or in cases of BMI. So basically, with the lifestyle medication, the homeopathic perspective in the form of constitutional along with adjuvant remedies is the best approach if the patient doesn't go towards the conventional medicine or suffering from the side effects.
Thank you.
It's Dr. Nevin, if possible, we can conduct the second part on 3rd April. 3rd April is available, latest, the nearest available date now.
Dr. Beatrix, you are welcome.
Thank you.
Yes, thank you very much. Thank you very much for the very, very good explanations and the interesting topic. So, but I really have to say one thing. We have to talk to, I don't recommend at all for the patients to take chemical drugs to lose weight. This is something terrible. I would not recommend at all. And it's very important that we educate our children in the form of a good alimentation. That's the first step we have to do as families and as mothers. So, and concerning homeopathy, I feel we can do some things. Like if a woman is coming with obesity, we have calcarea carbonica, we have kalium sulfodicum, we have sulfur, and I really see effects in my patients. Like I had a woman with diabetes here, and with sulfur, she's losing the, how you say, the form of desiring sweets. She don't need so much sweet. She's losing weight with the sulfur, and she's doing much better with the diabetes. So the choice first choice for all of us will be homeopathic treatment in the situation. Thank you.
Thank you, Dr. Beatrix. Dr. Nipun, are you there? Thank you so much for your wonderful session.
Yes,
And
ma'am,
now,
I'm there.
Dr. Nipun,
Yes, ma'am.
because I couldn't see your camera. Video. So I'm asking. Okay, thank you so much for your wonderful session. And now it is the time to move to Malayalam session. I am inviting Dr. Anjita for moderating Malayalam session.
Thank you.
Thank you so much.
Thank you, Doctor.
Thank you from
NIPUN
Thank you
Singh
very much.
Dabi.
Yes. Thank you.
Good night and love you all.
Congratulations.
I'm inviting Dr. Anjita to moderate Malayalam session. Dr. Anjita, you're welcome.